Well, I hope you're all having a good start to this semester. I wanted to again try to put the course material in perspective. I think this will be helpful as you go through the weeks of classes and the materials that we have provided in this course. It's important to keep it in perspective. One important point is that while the cultural competency of the individual clinician or medical staff, professionally trained medical interpreters, bilingual and bicultural staff, expertise in refugee and immigrant health issues on the part of the physician are all essential for adequate care and cannot be overstated. Systematic linkages between specific providers, resettlement agencies, health departments, immigration services, and other governmental organizations on the local, the national, and international level are critically necessary and are far more complex to accomplish and to coordinate than all of these other issues. They're all important and they all have to be addressed. But part of the solution has to be these linkages between all of the people that are involved, the collaboration, working together, and understanding that there must be a comprehensive approach, a comprehensive strategy to resolve all of these issues. Addressing these health system failures is difficult because obvious solutions are not available. The most effective methods of delivering comprehensive services for migrant, refugee, and mobile populations are unknown, as these populations tend to be underrepresented in medical and social science research and neglected, written out, or excluded in healthcare policy. The goal of truly comprehensive and high-quality care for these populations necessitates a highly integrated system of cooperative work and communication between the many organizations and individuals who provide services for these patients, a requirement that begins far before and extends far beyond the doctor-patient interaction at the examination table. On January 5th, 2012, the U.S. Department of Health and Human Services released its first global health strategy. In speaking about the strategy, HHS Secretary Kathleen Sebelius stressed the importance of global health and explained that the strategy will guide HHS's efforts and commitment to work with global partners towards building a healthier and safer planet for everyone. This strategy has grown from an understanding that the health of Americans and the health of people around the world are more closely linked than ever before. And this creates some very obvious and some very serious opportunities and challenges for all of us. The Secretary stressed that today it is very clear that a disease outbreak in a distant country can threaten the health of Americans at home, just as a discovery made in a foreign country can lead to better treatment for diseases affecting Americans. Greater movements of people and of products, including foods, feed, drugs, and medical devices, can increase exposure to potential health risks originating outside the United States. But this mobility can also make life-saving care more readily available for everyone. Scientific advances in medicine, healthcare delivery, and public health are increasingly built on international collaboration among leading researchers from which all benefit, regardless of nationality or source. The Secretary also emphasized that to meet the needs of individuals, communities, and countries, a systematic approach to global health is required. The U.S. global health priorities are articulated in the Global Health Strategy for the period 2011 through 2015. This strategic approach recognizes that public health, healthcare services, and health equity are best addressed across national borders and through collaborative international efforts. It must inform and be consistent with the agreements reached with other nations through international institutions and further U.S. priorities in international development, security, and diplomacy. The principles underlying the global health strategy are using evidence-based knowledge to inform decisions, leveraging strengths through partnerships and coordination, responding to local needs, building local capacities, ensuring a lasting, measurable impact, emphasizing prevention, and improving the equity of health. Please visit the HHS website at www.hhs.gov, where you will find the entire global health strategy and more details on the U.S. efforts in the U.S. as well as around the world to promote global health. Consider these as you go through the semester. Incorporate them into your thoughts. Incorporate them as you determine your health research project topic, as you complete your weekly assignments. These principles are important because they represent an initiative that is global in nature, but it's, again, very local because we're looking at the whole world from a national, international, and global perspective. So in doing so, these principles recognize the importance of developing home-based solutions to problems that can extend throughout the globe. So consider these as you select your topic for your semester-long research project. Consider them as you, and incorporate them as you prepare your weekly engagement assignments. I hope you have a great week. I'll be talking to you again soon. Thank you.